Thanks very much, John, and thanks to John and all his colleagues in Arthritis Ireland for inviting us to be part of today's event and also to be part of the coalition. I suppose while trying to present an employee perspective on this whole agenda, I risked repeating quite a lot of what has been said already. Like, clearly, it would be our position that work is good for your health, the financial security, the social capital, purpose and meaning, etc., the benefits to yourself, to your families, your wider communities, and unfortunately, of course, work is a relatively scarce commodity in our country today, and the opposite effect that has on so many people in our society is something that is a deep regret, obviously. So any system that encourages and supports people to remain or re-enter work as soon as possible is very welcome to us, and something that we would obviously be very interested in engaging with and trying to promote within our workplaces. I suppose an obvious point is that, and I was struck by the statistic, I think it was Emer and perhaps Professor Bevan as well, talked about a percentage somewhere in the region of 40% of MSDs attributable to work. So clearly prevention is a key issue. And John referenced some of the work that has happened in the Health and Safety Authority, etc. And that's work we've been involved in, and clearly that we attach a lot of importance to. The proposed solutions, I suppose, outlined in the paper are very useful. Issues that we're certainly up for considering and being part of, work streams that John referenced, to develop further recommendations. I agree with Mary in the sense that I think the level of awareness amongst trade unions about both MSDs and I suppose the whole Fit for Work system is relatively low, and that's something perhaps we could look at trying to address with John and his colleagues in Arthritis Ireland in terms of bringing the Fit for Work agenda beyond the people in this room and out to a much wider audience. John mentioned being on the board of the National Disability Authority, and the other John, there's many Johns being referenced here today. John Church referenced work that the NDA has been involved in, and I think Niamh Fall from the NDA is here, and she has, I think, been going around handing out this particular resource, which is very useful. It's key steps in retaining employees who acquire a disability. And as John said, I mean, there has been work going on that can be very useful to the development of this agenda, and we don't need to reinvent the wheel per se. So, I mean, just to summarize, I mean, I think clearly this system has the potential to be of huge benefit for employees. Obviously, just like employers who would need a sort of cost-effective system to be put in place. Clearly, in the current climate, extra costs being placed upon workers in this climate is something that we would be of concern to us as well. So clearly, those are issues we'd have to bear in mind as well. But I think I'll stop there.
Okay, thank you very much, David. Joyce.